Abdominal pain during running is common condition. It affects around 20% of population. Pain nature is sharp and cramp-like. It is also known as exercise-related transient abdominal pain. What is the most common cause of abdominal pain during running? It's side stitch, which is responsible in 80% of cases. Almost any cases when you have abdominal pain during running, it's side stitch. What is side stitch? Side stitch located usually on right side near rib cage, somewhere here, and what causes? There's several explanations. First explanation is irritation of parietal peritoneum. Parietal peritoneum lining our abdomen, abdominal wall here, and during running, when our internal organs are moving, they rubbing against parietal peritoneum here, and it can cause severe sharp pain. Another explanation is strain on ligaments. Here is liver somewhere, and here is gastric, our stomach, and they are attached to the diaphragm, especially with ligaments. And when they moving, these ligaments are stretched, and it can cause pain. That's second explanation. And third explanation is reduced blood flow to diaphragm. You can see this is diaphragm. Diaphragm is muscle actually, which separates from thoracic to abdominal wall from each other. Diaphragm plays important role during breathing, and in case of intense running, maybe blood flow is decreased to diaphragm, and it can cause diaphragm spasm, and it can be we can experience it as intense pain, especially cramp-like pain. So what to do, how to prevent this side stitch? Prevention methods. First is warm up properly before exercise, and it can be just simple stretching, or it can be brisk walking or jogging. It is warm up. Warm up usually lasts 5 to 10 minutes is enough. It helps to lessen side stitch. Another prevention method is regular exercise, regular training. People who regularly exercise, they have less side stitch. Breathe deeply and evenly. It's also important. Breathe and stable breathing helps diaphragm oxygenation. Relax your shoulders. If your shoulders are hunched forward and you running like this, it can cause spasm of diaphragm also. And core strengthening exercise, it's generally for our core strengthening and core muscles, and best method for it is plank. This exercise what you see is known as plank, and it's very popular actually, and it hardens our core muscles, and it's important also. And now, what are less common cause of abdominal pain during running, which are responsible on the condition but is not side stitch? It can be gastroesophageal reflux disease, also known as heartburn, and burning sensation. It's when gastric acid moves to esophagus. That's a mechanism of action. It worsens usually after eating and bending forward, and sometimes during running it can worsen, but it's not standard and common scenario. A person usually knows when person has gastroesophageal reflux disease, he already knows its symptoms. So when he runs, if he feels heartburn, he knows that it's heartburn and not other cause. Another cause is gallstones. Gallstones can located in gallbladder, and during running they can move and they can obstruct a bile duct, and it can cause pain. Gallstones pain is usually severe, and it also called colic-like pain also, and it's severe and steady, and pain can radiate in left shoulder. So this type of pain usually is related to eating, especially fatty meals, and after 1 hour or 40 minutes after eating fatty meals, pain can arise. And if person intake such fatty meals and then exercise, it can be coincidence, and sometimes it perceived as a pain during exercise. Actually, it can be gallbladder pain, and because exacerbated by eating, not to running directly. So running does not affect directly if these gallstones are not obstructing gallbladder duct. So that's but it's not common scenario also. That's the most common causes of pain during running. There is other very rare causes such as pancreatitis, for example, which is a serious condition, but we don't review this because such cases are very rare, and it's not directly correlated with running. What is directly correlated with running? We said this is side stitch. It's 80% of cases responsible on this condition, and maybe more. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.